esteemed directors, officials of the Ministry of Public Health, distinguished guests, ladies and gentlemen, Assalamu alaikum. I would like to start by really thanking His Excellency for really finding the time amidst his busy schedule to show his commitment to this very important event. It is a real pleasure for me to be here with you all today for the inauguration of this medical oxygen facility at the Indira Gandhi Child Health Hospital. What we are making today is more than just the opening of a building. It is a remarkable step forward in saving lives and strengthening healthcare for the Afghan people, especially the most vulnerable, the women and the children. Medical oxygen is not just a basic supply. It is a life-saving treatment. It is essential for patients with pneumonia, for safe surgeries, for everyone in critical conditions. It is especially important for newborn, children, pregnant women, and older adults who often depend on oxygen for their daily care. During the COVID pandemic, we have sadly witnessed how severe the shortage of medical oxygen could be and the devastating impact it can have. Many hospitals struggle to meet demand, and families faced with heartbreaking moments trying to find oxygen for their loved ones. That crisis reminded us very strongly how urgent and necessary it is to have a reliable on-site supply of oxygen. That is why today's event is so significant. With the generous financial support of the European Union, WHO has worked very closely with the Ministry of Public Health to establish this oxygen plant right here at the Indira Gandhi Child Health Hospital. Before this plant was installed, the hospital had to buy and transport 100 oxygen cylinders every single day to keep up with the patient's demand and needs. Through this new facility, the hospital can now produce enough oxygen on site to supply 45 ICU beds that will fill 210 cylinders, each with a 40-liter capacity, every 24 hours. This not only supports the hospital's patients, but also assists nearby health facilities when they need so. To ensure that the oxygen plant operates continuously, even during power outages, we have installed 4 high-capacity power generators. These will ensure uninterrupted power and help the hospital maintain life-saving services without interruption. The impact of this facility is wide-reaching. It will improve patient care, save lives, and make the health system more resilient and self-independent. It will also put Afghanistan in a stronger position to respond to future health emergencies. Just as important is the sustainability of this initiative. The plant is designed to be more efficient and easy to maintain, for which WHO will continue to support the hospital team with technical assistance, maintenance, and training. I'm also happy to share that WHO has provided the hospital with a pediatric bronchoscopic machine, an advanced equipment that will allow doctors to better diagnose and treat respiratory illnesses in children and, most importantly, save more young lives. In closing, the new oxygen plant, the power generators, and the bronchoscopy machine are not just investment in equipment. It is the investment into the health and the future of Afghanistan. They show what is possible when strong partnerships come together to support a common goal. On behalf of the World Health Organization, I sincerely express our deepest thanks to the European Union for their steadfast support for the best health of the people of Afghanistan. I also support the Ministry of Public Health and thank them for their partnership and close collaboration. Together, we're making real progress together, ensuring health quality is accessible to every Afghan, especially to the most vulnerable, and especially for those when they need it the most. Assalamu alaikum and tanwanina. The numbers that has been coming out from the study that we've done with other partners and with the government is that maybe around 79 to 80% of the health sector is supported by is supported by out of pocket, which means that people have to pay from their pocket 80% of the cost of healthcare. 21% of that, 19% of that comes from the international community. 1% comes from the de facto government. So you're looking at 1% from the de facto 19% from international community and 80% from the people. And so with the withdrawal of the current situation, you're talking about the 18 or 19% which will be impacted, which means that more will have to come from the people of Afghanistan that has already been experiencing a lot of shocks. So it will be more and more difficult if the situation continues. I think the numbers itself does not really tell the story of how many lives are going to be impacted by this impact. If you look at what I've said, 90% is supported by the international community, and especially where it is most difficult to be accessed, which we call the white areas, no? Which means roads are difficult, accessibility is difficult. So you're talking about a majority of the most vulnerable not being able to access healthcare. So it's not the numbers, it's really the impact on the healthcare. What we have to do together is, number one, on our part, to continue to advocate the needs of the people of Afghanistan, not just in health, but also for the other needs. And I say that with all sincerity, because good health is not just a result of people taking good health behavior. It's also access to clean water. It's also access to livelihood. It's also access to education. And so if we are able to address all of this together, the impact is better health. So my message is that don't forget Afghanistan, because the needs of Afghanistan are huge, not just in health, but in all the important sectors. So let's look at beyond the numbers. Let us look at beyond the impact of the numbers that they've had. If we look again at the support of the American or the US government to the humanitarian needs of Afghanistan, we're talking about, I cannot exactly remember the exact figure, but the figure is 47% funded by the US government. 47, it is almost half. So imagine a certain number and half of it is no longer available. That's a tremendous impact. And so what we're trying to do again, collectively with the international community, is to see what are the priorities that are really needing to be addressed with the limited funding that we have. Number two, increase partnership with other goodwill donors, like the European Union, whether they can find additional resources that they're already supporting in addition to what they're supporting to Afghanistan. And maybe also encourage other partners like the Gulf state, like the other governments that don't usually support as much to Afghanistan. Maybe we're having a dialogue with them collectively to see if they can increase their support to Afghanistan to at least cover some of the loss that has been because of the US government. But the reality is that we will have to look at the priorities because the funding will never be enough.
لید نیوز، جایگاه خبرهای متفاوت.